Hello, welcome to the Fundamentals of Anthropometry, Chapter 3, Session A. Myself, Dr. Sandesh Lakmade from Dapoli Homeopathic Medical College. I am a professor and HOD in a department of Dapoli Homeopathic Medical College. Today, see the fundamentals of anthropometry in a chapter 3, where we will learn about the anthropometry in children, the age group 0 to 5 years. Okay, as in a chapter 1 and 2, you have already learned about what is anthropometry and its importance. Here we will learn about the anthropometry in a children from the day of a birth to the completion of 60 months of the life, that is 5 years. Now, anthropometry, the word anthropos means a humans, and metrons means its measurement. So, in anthropometry, we are going to learn about the measurement of human body parts, and according to the age and the sex and their importance, which will guide us about the diagnosis of a certain diseases and their management, and also we come to know about the prognosis of the disease from this. So, here I will start with the session A of the chapter 3. So, anthropometry is the measurement of the body. Anthropometry can help to identify the type of the malnutrition present in an individual or a population and measure progress to our improvement. So, what management we are doing to that a malnourished child is really working or not by doing again the remeasurement of that child. However, it does not identify any specific nutrient deficiency, like we cannot identify any specific vitamin deficiency from the anthropometry. For example, this is a clinical diagnosis, the deficiencies of any nutrient, that is a clinical diagnosis. For example, the scurvy, the vitamin C deficiency, we find out from the examination of the inflamed gum likewise, but through anthropometry we can rule out the gross malnutrition of the child. So, common anthropometric measurements used in a development program are the height of the baby, height or length of the baby. In very small children, we measure the lying length of the baby, then weight of the baby for the age, then head circumference for the age, body mass index, that is a BMI, and the mid upper arm circumference we use for diagnosis of the certain diseases in children. Now, this video will tell us about how the mid arm circumference is measured. So, in this video, first a vertical length of the arm is taken, then a midpoint of the arm is marked, then a measuring tape, which is a non-stretchable measuring tape used and is encircled around the mid of the arm, which is placed in a cross where the readings are taken. This is how the mid arm circumference is measured in children. The anthropometry is commonly used to assess the growth pattern and nutritional status of the individual. So, as I have already told you, so the child is growing normally or not, the child is having a low birth weight, or there is a stunting, there is no growth or undergrowth or underweight child, or sometime in children there is overweight, obesity is maybe present. So, whatever is the disease of the child or the maldevelopment or overdevelopment of the child, that we diagnose by using this anthropometry. So, it is used by health providers such as doctor, nurses and others to identify at risk individual who are malnourished and administer a proper care and treatment to that child. Anthropometry of a children from birth to 5 years of age, that is 0 to 16 completed months, is broken down into a specific section to elaborate the importance of a nutrition for children of this age group. The common nutrition related condition identified by anthropometry like kwashiorkor, marasmus, to understand the measurements and indices used by to identify nutrition related conditions and learn to interpret anthropometric measure and classification of nutritional status. So, this anthropometry help us in this diagnosis of certain either malnourishment, overnutrition, obesity, overweight children. The general notes about the infant's anthropometry: all measurements are taken and recorded independently, means there are 2 or 3 readings are taken from that deceased child. There must be a blinded recording, means the 3 person or 2 persons are measuring the child in a 2 or 3 different room and keeping their own different records, individual records. So, by that we can come to the accuracy of that measurement. So, measurements are to be recorded on appropriate data collection form. So, each that measuring individual has its own data form on which he will put measurements. All measuring of infants take place either in a delivery ward or the nursery, in an ICCU or a preterm follow-up clinic. So, these are the places where this early measurement of the children are taken. The length and head circumference recorded to the last completed unit, not to the nearest unit. For example, if the head circumference value lies between 34.2 and 34.3, the value of 34.2 is recorded. Means for head circumference, if 2 person has taken the measurement of the head circumference and the readings are 34.2 from one measuring person and the 34.3 from the another measuring person. So, we take the value 34.2. Each measurer record their measurement of each baby on own page of the form, so that the measurer records the measurement independently of each other. All forms were designed centrally by the coordinating unit. So, both individuals have the similar type of the form. Each measurer must wash their hands thoroughly before and after handling of the baby. So, this care must be taken. Nowadays, we use the term anthropometry, but in earlier days the term was failure to thrive was used instead of the anthropometry. The failure to thrive means the baby is either undernourished, malnourished, having a low birth weight or stunted baby. So, for that the term was used, the failure to thrive. That FTT now has been widely used during the last century to describe poor growth in early childhood. The condition traditionally been classified on the basis of presence or absence of the somatic illness, with most cases being of a non-organic or of a mixed origin. So, for this measurement it was not required to that child should have some organic disease or some body illnesses. So, this measurements the baby is not growing at its normal rate, that it was termed as a failure to thrive. In early literature, definitions of FTT includes the emotional and behavioral symptom, which strongly linked the condition to maternal deprivation and psychological adversity. However, the consensus in 1985 concluded that the primary identification of FTT must be based solely on anthropometric parameters. So, the failure to thrive is now based on a anthropometric. So, proper measurements of the children are taken. There are the worldwide the criteria is made for the measurements of the body part in a children for age group, given age group, in days, in a months, their height and weight is measured, and the normal values are also given and the below normal or above normal values are also given, by which we can diagnose the baby is either undernourished or overnourished child or the having the normal growth. The concurrence between the different criteria of FTT, however, is low, and different criteria are likely to identify different child population with different risk of adverse outcome. So, as there were it was not based on some particular criteria. So, there were the differences in a diagnosis of the FTT in a different age group, different sexes. Later on, this criteria is discarded and the anthropometry is come into picture. So, thus during the last decade it has been suggested that this rather vague term should be abolished in favor of more valid anthropometrical description based on explicit measures of growth or nutritional status. Now, why does the nutrition from birth to 5-year age matter? Good nutrition, adequate health care and nutriting environment are all extremely important so that children reach their full growth and developmental potential. Utmost care must be taken a couple of months before beginning of mother's pregnancy to child second birthday. So, good nutrition, the adequate health care and a nutriting environment is required for the child's mental and physical growth, a complete mental and physical growth and its developmental potential which help that child for his future education and whatever future he do in his life. So, utmost care must be taken. So, for that before the pregnancy the mother must take care of her own nutrition during pregnancy, before pregnancy. So, the normal healthy child she can give birth to the normal healthy child. This is when the children are growing and developing most rapidly during this 0 to 5 years of age. In order to support this growth, young children have relatively very high nutritional needs and are more vulnerable to malnutrition and its consequences than other age group. So, during this birth to 5 years of age, the child is growing faster, its organs are developing, his limbs are developing, the child getting somatic and mental growth also. So, that time the good nutrition is required for the child, and if they do not get the good nutrition during this period, so they may have some developmental problem and the consequences than other age groups. Malnourished children are at a high risk of illness and death than well nourished children. So, if the child is a malnourished, so maybe having a low immunity, so there are more chances of infectious diseases and death also. So, undernutrition is associated with a 45% of a death of a children under 5 worldwide. So, undernutrition is a big cause of a worry all over the world. It is associated with 45% of a death of children under 5 worldwide. Lack of proper nutrition during this formative year can have lifelong and sometimes irreversible consequences to the child's life. So, this includes the impaired cognitive development, a lower school performance and achievement, a reduced economic productivity, increased risk of certain chronic disease in childhood. So, these are the consequences the child may face if it is undernourished or malnourished during the first 5 years of his life. Preventing malnutrition with the proper nutrition and making sure that the child getting everything that he or she needs during these formative years can help substantially reduce death and ensure that children grow optimally both physically and mentally. Luckily, the children below age of 2 years are very responsive to nutritional interventions and recover rapidly from the malnutrition. So, it is observation when these malnourished children are given the proper nutrition, they recover faster. So, diagnosis of their malnutrition is important where this anthropometry help. Increase in infant and childhood overweight and obesity has also become an emerging problem all over the world. So, not only the malnutrition, but the overnutrition, the overeating, the overweight and obesity, these are the emerging problem all over the world we are facing nowadays. Overweight and obese children are at a higher risk of developing diabetes, high blood pressure, respiratory problem, asthma, or being obese in their adulthood, with increased associated risk of non-communicable diseases, disabilities and premature death. So, not only the malnourishment, but also the overweight and obesity is also the risk factor for these children. Anthropometry helps to diagnose the following problem in age group 0 to 5 years. The low birth weight, then small head size, small or large head. If the head size is a smaller, that is called as a microcephaly. If the head size is a larger, that is called as a macrocephaly. So by doing the head circumference measurement, we can diagnose the child having microcephaly or macrocephaly. Then stunting, the growth is stunted, there is no normal growth of the child. The wasting, that is another diagnosis we can do through the anthropometry. Then underweight, overweight and the obesity. These are the factors we can diagnose from the child having age group 0 to 5 years with the help of the anthropometry. Low birth weight, which is the biggest problem faced all over the world, especially in developing countries. The low birth weight refers to an infant who weighs less than 2500 grams at birth. It is measured on the same day within 24 hours of the baby's birth. It's our observation whenever any child born in a hospital, the relative asks the first two questions to the doctor: is it male or female? So that is they have curiosity about knowing the sex of the child. And the second question is always how much is the weight of the child. So by weight of the child, they want to know about the health of that newborn baby. So if the baby's weight is about 2500 grams, then it comes under a normal weight. But if it is below 2500 grams, it is called as a low birth weight baby. And if it is less than 1500 gram, that is called as a severe low birth weight. And if it is less than 1000 gram, it is called as a extremely low birth weight baby. So incidence of preterm baby constitute about 2/3 of low birth weight babies. So mostly the low birth weight babies are preterm babies. So out of 2/3 of the preterm babies are low birth weight. Low birth weight can occur in an infant who are either born early, that is a preterm, that is before 37 week of the gestation, or they are small for the gestational age and born at the normal term. So they born after normal term, that is a total 9 months, and but still they have a low birth weight. So that is age small for the gestational age. The term or the both small for gestational age and born early. So third is the baby, preterm baby, and also having a less weight for that gestational age. So these are the three criteria are for the low birth weight. So low birth weight can occur in infants who born early, that is a preterm birth, or second the full term but the weight is less for that gestational age, and third is both the preterm and the weight is small for the gestational age. So this is how the low birth weight baby looks, and which needs emergency management. The baby must be kept in a warm compartment in an NICU. So low birth weight is associated with issue as like increased risk of infant's death. So these low birth weight babies have a more risk of a death, mostly due to the infectious diseases. Then childhood stunting because of the chronic malnutrition, then reduced brain development in early childhood. Children who are both for small for their gestational age and born early are at a highest risk and therefore need a special monitoring and care in that group. About 50% of the preterm are low birth weight babies. The incidence varies from country to country. 80% of the neonatal death and about 50% of infants mortality are due to a low birth weight. Then about 10% of all birth weight babies requires admission to NICU. Then Pakistan had the highest prevalence of low birth weight, followed by Nepal with the average birth weight on 1988 grams to 2255 grams respectively. But still the death rate is more observed in African countries in low birth weight babies. Then what are the causes of low birth weight in babies? Either the baby is born prematurely, Then there is a fetal growth restriction. The fetus is not well developed in the mother's womb, that is intrauterine growth restriction. Apart from preterm labor, various factors contribute to the birth weight of the babies like chronic health condition, placental health problem, persistent medication and infections of the mother. How to identify the low birth weight baby? What are the manifestations? The weight is 2500 gram or less and length is usually less than 44 centimeter. The baby having weight less than 2500 gram and the length of 44 centimeter is called as a low birth weight baby. Then head and abdomen are relatively large. In those babies, the limbs are thinner and the head and abdomen are large. The skull bone are soft with a wide suture and post frontinalis. The skull bones are soft, they are widened. So, the sutures are widened and post frontinalis are widened. Then head circumference is disproportionately exceed that of the chest. So, head is larger than the chest. So, head circumference is more. The pinna of the ear are soft and flat, eyes are kept closed, skin is red and shiny due to lack of subcutaneous fat and covered by plentiful of lunago and vernix caseosa. So, lunago is thin shining hair present on the baby which are more seen on these preterm babies or underweight babies, the low birth weight babies. The vernix caseosa is a white creamy covering over the baby when the baby is born. So, that is also more observed in this low birth weight babies, and because of the less amount of the subcutaneous fat, the baby has a shining skin. Then plantar creases are not visible. On observation of the plantar surface of the foot, the creases are not well developed. A very minute creases may be observed, especially in the low birth weight babies. Nails are also not grown fully, so they do not cover the tip of the finger. Testicles in these babies in a male child may be undescended, or in a female the labia minora are exposed because of the labia majora is in a contact. So, these are the some manifestations of the low birth baby we can observe. So, especially first by measurement of a weight and length, the measurement is a less than 2500 gram, we label it as a low birth weight baby, and also the length less than 44 centimeter. The head is relatively larger as compared to the chest and limbs, and abdomen is also large. So, the head circumference is a larger as compared to the chest. The ear pinnas are also thin. Then plantar creases are not visible, nails are not grown up to the tip of the finger. Then there are the categories. I already mentioned you about the categories of the low birth weight. The normally the low birth weight we label it as when the weight is below the 2500 gram, but if it is less than 1500 gram, then we call it as a very low birth weight baby, and if it is less than 1000 gram, then we label it as an extremely low birth weight baby. The pregnant woman's nutritional and health status before and during pregnancy affect both the growth and the fetus, growth of the fetus in the womb and risk of the preterm birth. So, for that before the planning of pregnancy, the woman's nutritional status must be observed, that woman must take care of her own nutrition. So, before and during pregnancy, so she can give a birth to a healthy child, and she can avoid either a preterm birth or the low birth weight baby. So, mothers who are short, that is who are having a height less than 145 centimeter, that is about 4 feet and 10 inches. So, the height, those women having height less than this, so they have more chances of the risk of giving birth to the babies who are small for their gestational age, or the mother is if underweight, that is her BMI, the body mass index less than 18.5 before the pregnancy, they also have a risk of giving birth to the babies who are either small for their gestational age or the having a low birth weight. Then after the low birth weight, the another important point about measuring the child is a small head size or the circumference. We name it as a microcephaly. The small size or circumference, also referred as a microcephaly, is the result of problem with the brain development which can occur in the mother's womb, that is congenital, or during infancy also. In microcephaly, the child's head is smaller than the expected for his or her age and sex. So, this is the picture which showing the head size is smaller than the child having a normal. So, in this picture we see on the right side the child having a normal head size, and on the left side the child having a small head. So, microcephaly has been linked with poor cognition and therefore lower academic performance. It often indicates that the child's brain has developed abnormally. So, as the skull bones are not grown, so it restricts also the development of the brain. So, therefore, they also affect the cognition power of the children, and which affects its academic performance in the future. So, there are two types of microcephalies, either it is congenital, that is present at birth, or acquired, that is developed after birth, that is during infancy. Now, what are the causes of the small head in fetus? A microcephaly may result from a genetic disorders. Certain genetic disorders may affect the development of the skull bones and the development of the brain also. Then infections such as rubella, toxoplasmosis or cytomegalovirus, they also may affect the development of the baby's head. Exposure to certain drugs or chemicals of mother during pregnancy, that is the teratographical drugs. Poor fetal growth, severe malnutrition. Then small head size is determined by using the head circumference for age index for the child's sex. So, the diagnosis of this microcephaly is done by measuring the baby's head with the help of the non-stretchable measuring tape, by which we can diagnose the baby having a microcephaly with its comparison with the head size of the normal child. Then after microcephaly, the another thing we can diagnose with the head size measurement or the head circumference measurement is a macrocephaly. Macrocephaly is the size of the head is larger than the normal size of the head observed in a babies. So, it is also a medical concern and can be identified through anthropometry. Macrocephaly has no nutritional cause. It can be result from enlargement of the skull bone or an increase in a volume of the intracranial structures like cerebrospinal fluid, that is CSF, the blood or brain parenchyma. So, increased amount of the accumulation of the CSF inside of the cranium or increased amount of the blood flush to the brain, continuous flushing of the blood, and the increased amount of the brain parenchyma, it may cause the stretching of the skull bones, so which may cause the macrocephaly. It may be secondary to raise in the intracranial pressure or a space occupying lesion. So, increase in the intracranial pressure is maybe because of the increased accumulation of the CSF in the within the cranial cavity, and or the space occupying lesion, any tumor may be occupying the baby's head or the brain. So, that may also cause a stretching of the bones of the skull, and we observe the large head in those babies. The most common cause of macrocephaly is a familial macrocephaly, in which the larger head size runs in the child's family because of the feature of the skull and the brain growth. So, every time it is not some disease, but it may be a family having a large head. So, that may be observed in the child. So, many people with a large head or large skulls are healthy, though they do not have any other manifestation than having a large head. Then hemimegalencephaly, that is a half side of the head is a larger, or there is a asymmetry in the head and brain enlargement, where we see the one side of the head is maybe larger and other is maybe normal or smaller. Some patients also have somatic hemihypertrophy seizure, then developmental delay and hemiparesis are common. In those patients, we may observe the hemihypertrophy. So, half side of the head is a larger and which may develop the seizures, then a developmental delay may be observed, and hemiparesis are the common symptom or the common manifestations observed in those babies. Then what is the treatment for macrocephaly? An infant with a benign familial macrocephaly will not usually require any treatment other than monitoring the head size.